Hello there, welcome to the clinic. It looks as though a medical professional is organised for the day. So before they start their clinic, let's have a look at what they've got with them and how some of this equipment and tools possibly works. So they're clearly well stocked in the pens department there, that's good. So they're going to be doing written notes by the look of it. There's some of the ocular and general medical tests there they're going to be performing. Excellent. Right, I noticed they had some eye drops and some free samples. Optase Manuka eyelid wipes here. Hyaluronic acid, 4 biodegradable wipes. It's going to be good for dry eyes, cleaning makeup, antibacterial properties. Your ingredients there. Good. They're thinking about the patient's lid hygiene. I think they have some dry eye drops here. So they have Adteas, 0.5 hyprimellose, 10 ml. Always good to have some samples in the clinic. The patient can then purchase if we find out that they have dry eye syndrome, symptoms of dry eye. One of the popular ones on the market is Hycosan. Again, look, this is a sample they've got with them. The pump action bottle, hyaluronic acid and ectoin. These usually last 6 months from opening. Let's check the date. July 28, good. Appears to be unopened. It's sealed there, so it's good. Also have some other samples for the patient to try, some micronutrients for the eyes. So ingredients list. Apparently these can help with floaters. 3 capsules per box, lovely. We have some diagnostic dyes, so we have sodium fluorescein, good for corneal staining. Lissamine green, good for conjunctival staining, so let's put those with the slit lamp. Organising their clinic for them. Thermometer, very important, checking whether the patient has fevers, viruses and things. Seems to be in good working condition. Okay, can we see the previous history? Yep, there you go. Previous readings, good. Right, I've never seen a doctor bring nose pads and a spectacle repair kit. So we have special tweezers for screws, possibly a screwdriver in there, and various types of hard and silicone pads there. a medical professional will be doing is looking in the patient's throat. So we have a disposable tongue depressor there, looking at all the tissue in the mouth, the teeth. Excellent. I'll also need a light source, so it looks as though over here they're utilising the ophthalmoscope with charger. Seems to be in good working condition. And charger, lest the battery issues. Good. Apertures. And the filters required. Good. On and off, and brightness bar there, brightness wheel. A range of different powers. Focusing wheels there, good. Looks as though we have some vision charts. Because we're quite a small clinic, we can use the reduced Snellen from 6/6 division to 6/6. And with the near chart there. And I think we also have another one. This one comes complete with Amsler grid. Impressed with our medical professional and their ability to be organised, forward thinking. It's by Bondi. So now check vision, they can use the Occluder, block one eye, block the other. Pinhole vision is possible. Intricate measurements using the scale there, and pupil measuring the scale. Again, they'll check the pupils with the light, all being well. It's double-sided, and can do the cover test. Stethoscope, listening to the heart and the lungs. This is very fancy. Comes in protective case. There's the drum. Lovely. Also a little storage area at the top. Marvellous. Notice that our medical professional also has a Goldman tonometer with the probe. That's going to need sterilising. That's a reusable one. Okay, pop that with the slit lamp, I'll come back to that later. It's used in conjunction with this machine here. Right, chopsticks. Not sure whether this is for the doctor's lunch or for a scalp examination. That's clever. Yeah, we could use those for scalp assessment. Right, looks as though we have a pulse oximeter. It's very important in the clinic. Patient's oxygen levels, and you can also check the heart rate, I believe. Let's see if this works. There we go. 98%. 96, 97 beats per minute. Okay, could be a little bit more relaxed, but at least we know this works nicely. Excellent. Right, a model of the eye. Models are perfect in the clinic for demonstrating what you're talking about. Alright, a cross-sectional view of the eye. I can explain where certain conditions are, findings. So there's the cornea, the iris, and the lenses are there. So you could certainly demonstrate a cataract, depending on the type you find. There you go, a nuclear cataract. That's where the lens is found in the eye. Excellent. Cortical cataract. Peripheral spokes. This is a super piece of kit. And of course you can talk about the inside of the eye. Talk about the optic nerve head. Vessels at the back. Eye muscles. Lovely. Tuning fork for a hearing function test. 256 Hertz, note C. These are substantial pieces of equipment. Seems to be working nicely. Right, colour vision, very important in the clinic. So our professional's got the Ishihara test, 88 plate edition. Lovely condition. Just have a look at the plates themselves, at least some of them. So I can certainly use that to check for congenital colour defects, and you can also use it monocularly to compare between the two. For red-green defects, proton and deuton, I believe, with this one. Alright, what I also use for checking red desaturation is the red ball on the stick here. So this will have a multitude of functions. You could use it for convergence checks, ocular motility tests, follow, reporting any pain or discomfort or double vision, or you can compare the colour difference between the two eyes, so a red desaturation test. But if you suspect somebody's got an acquired colour defect or optic neuritis, right, we covered the ophthalmoscope. It looks as though there are some grading charts, very useful. Vision Care Institute grading scale. This is where the dye will come in to play that we previously saw. Never seen one of these before. This is a new grading scale. Look at this. Slit lamp techniques. Different zones. Sodium fluorescent lissamine green staining. Rose Bengal we don't use. Palpebral, upper palpebral zones there, the lid. Demonstrating the conjunctival staining with lissamine green, Rose Bengal. And further information there. Some more serious things, inflammation, corneal inflammation is serious. See an infiltrate there. And corneal ulcers, which are serious. Some more Amsler charts here. Information on new products, glow caps, Reti caps, and floaters there, so the vitro caps. So over there, good. Right, some information booklets here. Ocular hypertension, glaucoma UK. Information on the condition. There's the year science. Possibly some lens filters and dispensing information. This one. Yeah, can explain about transition lenses from an ocular health point of view. Lovely. information and keeping your eyes comfortable from tear. There's quite a lot of dry eye type products. Okay, eye conditions, understanding eye health. Let's focusing on the dry eye. Blepharitis products. Application, good. Excellent. It looks like we've covered everything on the table there, I think. I've left it a bit of a mess, sorry. Oh, one more thing on here I noticed, the RF rule. Right, what can we use this for? Well, we can use it for amplitude of accommodation. Near point of convergence. We want to measure the distance specifically. Oh. Working distances as well. Centimetres, diopters for amplitude, convergence, and the age range there for what your accommodation should be. Excellent. Right, let's have a look at the slit lamp. Whoops, knocking everything over. So the Goldman used like so, goes on this little plate here that is detachable. That's into one of the holes there. There we go. And that's ready to rest against the patient's eye. We did say that the probe needs sterilising between patients, very important. Focusing wheel. Filters. For goodness sake, I'm going to be breaking everything. It's going to change the size of the height of the beam. So with the controller there of the beam. Chin rest, headrest and occluder there. I don't always use an occluder myself. It's good if a patient's got a squint. So we spoke about the Goldman, the dyes. Looks so we have a 60 diopter Volk lens. Great lens for macular optic nerve function of checking. Good magnification of about 1.15 times. The lens is held around 13 millimeters from the patient's eye. On the slit lamp. Rest there and like so. And use the other hand to adjust. You have to be ambidextrous. Lovely Volk lens. Double aspheric design. Super duper. Right, I think that's all their equipment. Let's get out of here before they return for the day's work.